star begins to fall asleep here. So let's stay on coronavirus for a minute or two
Okay.
because there's another kind of, I guess it's not a crazy development. It's a little bit of a predictable kind of a development in the world of therapeutic treatment for this killer virus. And that's the emergence of a new medicine or a new medicine cocktail that apparently is very, very effective.
Not new. Um,
It's new to me.
Ivermectin.
Ivor what?
Ivermectin. It's actually it's been used for years in with farms.
With
And
farms.
yeah, farms like cattle and livestock. You would give them ivermectin for actually for preventing dun, 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 coronavirus
Okay, so cattle can.
and or other parasitic infections
Well, I
that
heard that it was used for
livestock.
parasitic. I didn't realize it
Right.
was used for viral.
Yeah. Oh, yes, it has. And
You sound a little bit just ever so slightly enthusiastic about this medication.
well, because I am, you know how I feel about the vaccine and anything that comes out that is more along the lines of if somebody gets sick, let's treat them rather than push.
The vaccine agenda, which is obscene and disgusting.
I just, I have my own fears about that one.
Okay.
But what did you come up with ivermectin?
So there's a couple articles actually. A combination of FDA and TGA approved ivermectin, zinc, and doxycycline. I don't know what the TGA is, but I have a feeling it's something like a foreign equivalent of the FDA. Has shown positive results for COVID-19. It should be considered immediately to fight the pandemic, says CDD Medical Director Professor Thomas Bority. Sorry. Australia's the Centre for Digestive Disease, the CDD, Medical Director Professor Thomas Bority, MB, BS, BSc, Med, MD, PhD, DS, ABC, D, EFG, HCQ, LGBTQ, RSTUV, has approved ivermectin, which he uses regularly in his hospital, has
Yes.
shown positive results for COVID-19 and should be considered immediately to fight the pandemic.
Phase 3 trial. It's already been done. It's already
Ivermectin was discovered in the 1970s and is on the WHO list of essential medicines, just like HCQ.
and it's FDA approved.
Okay. Professor Bordy has used the same methodology with COVID-19 ivermectin triple therapy as he used when he developed the world's first cure for peptic ulcers. I mean, that's an accomplishment right there. Curing peptic ulcers with an oral medication? Are you kidding me? That's pretty cool.
Well, a lot of parasites they infect the gut. So that's why you would treat livestock and especially with ivermectin.
Because they
Now,
walk around in their own poop all the time and get infected with parasites.
oh yeah,
And they go,
worms and stuff.
I'm actually mooing. I'm actually mooing on the podcast. That's where we're at right now.
We are there.
So he says this combination of 3 approved off-the-shelf drugs could be the answer to COVID-19 crisis in Australia. If nothing else, and here's the segue from our previous topic. He says, quote, if nothing else, make it available in aged care homes immediately. Elderly are at the highest risk, and this is a very safe option, especially when we have nothing else except ventilators. I wonder how this compares to HCQ in terms of cardiac side effects, because isn't there like a rare cardiac side effect with hydroxychloroquine that's the whole reason why they're saying it can't be used for COVID?
Every medication has side effects. It's just whatever they want you to hear as the reason why. I know because I was told by somebody that is higher up in the food chain than I am, that was our standard treatment was HCQ,
In other words, it was the standard
zinc,
treatment of the
and
organization
and
before they banned it.
azithromycin. And when I asked why aren't we using it, if our first extubated patient was treated with that, the answer was because the CDC, AMA, and WHO said we cannot use that as treatment. Boom.
It almost
That's
seems
the
like
source.
they wanted positivity to skyrocket.
They want positivity to skyrocket so they can push an agenda that has to do with vaccination.
Okay. So,
And that's why I'm excited. Hello, here's something else. If you can't take this, then we have this.
well, how much do you think ivermectin costs?
It's cheap.
Okay. So it's cheap like HCQ.
Yes.
And
It's cheap.
the other
It's
drugs in the cocktail are also cheap, right? Doxycycline is a nothing drug, and zinc is a nothing mineral
Right.
supplement.
There we go. It can cost as little as $2, which would make it by far the cheapest, safest, and fastest cure for Australians and the Australian economy. Of course,
Do you
that's
think
where the study
Americans are
was done.
different? Maybe ivermectin doesn't work over here, and
Oh, because we're so different. We're so biologically different.
Yeah.
I think we pretty much have the same story, but I have it in the more of the clinical.
Hit me with it. You are the clinical mistress. Let's hear it.
Although several clinical trials are now underway to test possible therapies, the worldwide response to the COVID-19 outbreak has been largely limited to monitoring and containment. We report here that ivermectin, an FDA-approved antiparasitic previously shown to have broad-spectrum antiviral activity in vitro, is an inhibitor of the causative virus SARS-CoV-2 with a single addition of Vero H. SLAM cells post-infection with SARS-CoV-2 able to effect 5,000-fold reduction in viral RNA at 48 hours. I want you to put that number in your mind.
5,000-fold.
5,000-fold reduction in the viral load, the viral RNA, which is a viral load that's in your body, at a 48-hour window. Now, what they want to stress, though, is that it's most beneficial if it's taken on in the early stages of the infection. That's where they're seeing the biggest results. So, patient newly positive, they're starting to show symptoms.
That's true of
You hit
HCQ
'em-
as well, right?
Right. You hit them with ivermectin. You don't have to hit them with a high dose of it. It's doing the deal. And it's not just that. I think if you backed up a little bit on your screen there, it's used to treat a whole bunch of different things.
Yeah, it was
dengue
intestinal
fever,
parasites,
but
lice and mites.
those are the parasitic. But
It's used orally. It's used topically. So it says ivermectin can block the cargo transporter, so viral proteins can't get into the nucleus, which is the same way HCQ works when accompanied by zinc, right?
Exactly. So what happens is you have a cell, and you have receptor sites in the cell, and in that membrane. So then you have zinc that attaches to that cell membrane and acts as a block, and essentially for something to come in, but then has think of it like a magnet. It has the ability to attract either HCQ or ivermectin into that receptor site, and then essentially decrease your viral load that way.
Do you understand the difference between the role of ivermectin and the role of doxycycline in this drug cocktail? Or
Well, doxycycline and azithromycin. Okay, so HCQ, azithromycin, zinc. That was that therapy. You have
Antiviral, antibiotic,
and zinc,
immunity booster.
right? Same premise here. You have ivermectin, doxycycline, which is also an antibiotic, broad spectrum, zinc, and it works. And according to my source was through the Australian study that was posted sciencedirect.com. And
Which means it was probably already in a journal.
it is.
How
It's
does this stuff not hit big media? I mean, how does this stuff go under the radar? The article that I read was from May. I mean, this is, if it's dead bang, why aren't they reporting it?
well, because agenda. I can't stress that enough.
Give us your 90-second version of what in the hell is going to happen with the vaccine. Give me the doomsday version of what Jasmine Star predicts. You got 90 seconds and go.
Doomsday prediction. Are we going total rabbit hole? Or are we?
And 80 seconds.
I know this. I can spew them both out.
Do it. Spew them both in 75 seconds.
Best case scenario, you get a vaccine that's been Operation Warp Speed. It's cut through all the red tape that the FDA demands of most clinical trials to release any medication or vaccine onto the market. NCVIA is an act that protects the producers of vaccinations and not the consumers. If you do your research, you will find that there are several alarming side effects of taking the vaccine in the studies that they have done. That's why I urge everyone to do their research on it. Doomsday. If anybody's seen Bill Gates,
And they know what a goofball looks like.
well, you
Makes me so glad I was a 32-bit non-Microsoft guy 20
I
years
just
ago.
when you hear things like DNA splicing and being able to use DNA splicing as a way of altering human DNA, that makes me very uncomfortable. I am not going to go any deeper into that. I just want you to sit there and think about what that means by doing anything that causes an alteration in your DNA.
Yeah, I mean, because this is the guy that couldn't make a computer not crash for the first 18 to 22 years of his product.